generally when I do the presentation, but there's a part where you talk about personalities, and there's 5 different personalities in Chinese medicine, and she's already heard my spiel about this, but I'm a fire personality, so I'm like a little bit jittery, I'm a little anxious, I have a big heart, I'm very passionate, like blah, 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 blah. And so when I put needles in, I start to dry heave. It's an overwhelming excitement of what we call chi. And so they were like, you need to remove yours. And I was like, oh. And I'm looking around and everyone else is just like, oh, this is great. And I'm like, why do I feel sick? And they're like, you're a lot. Which is like, this Chinese lady is like, you're a lot. And I'm like, well, that's fair. I've been told that a lot. Like, I was like, yeah, okay, that makes sense. She's like, you need less. You need bloodletting. And I'm like, oh, okay, sounds good. Very 1800s, but okay. So, yeah, that's what I do. All right, should we start?
Absolutely.
Okay, so I'm Cecilia Sawyer. I'm here to present about acupuncture. Acupuncture is one of my new passions. Well, not new passions. I've been certified since 2014, but it's a passion of mine in veterinary medicine. I'm also a veterinarian, so I thought I'd introduce myself. I haven't met a couple of you guys. So I graduated from the University of Missouri in 2010. I focused on equine and also at that time a little bit cow-calf, but then ended up at Root and Riddle Equine Hospital in Lexington, where I did tons of breeding work, sales work, that kind of stuff. So much emergency. Loved it. It was one of the best years of my life. Went to Horseshoe Farms, which is a standardbred breeding farm, where we had about 1,600 horses and we had about 400 foals that year. And so I did that for a short time before returning to my husband's kind of home area around Kansas City, and I became a resident vet at a large quarter horse breeding farm outside of Kansas City. Stayed there for a while. Kind of had thought about going to acupuncture school, seeing it through my time at Root and Riddle, and then having some issues with breeding, like getting the mare to clear all the fluid and, getting stallions to be healthy through the whole season and that kind of thing. And in Texas, they will actually do chiropractic and acupuncture on the stallions to keep their sperm quality up, and it makes a difference, anecdotally. So I was like, this is something that I'm interested in. It works with what I'm doing. And of course, my friend from Virginia, she was doing it. She was seeing it a lot in dressage horses, anything on the East Coast, they're doing it a lot. So I ended up attending and getting certified. I completed the program in 2014. I was certified in 2015. There's case studies and internships and that kind of thing that you have to do. And I did my internship out in California with Dr. Kevin Mays, who's actually an instructor at the other school of acupuncture. So there was at the time basically 2. So I studied at the one in Florida. He works at the one in Colorado, and I believe it's Colorado. And I ended up going out there and following him around, and he worked on Olympic dressage horses and all these like super fancy, beautiful, amazing horses out there. And I saw it kind of in action and really kind of caught the bug. We actually ended up moving to St. Louis after that. My husband works for Nestle Purina downtown. And so I started my own practice and ended up joining with Homestead Veterinary Hospital out here in Washington, where I worked for a while until I started having kids, and ended up focusing a little bit more on kids and then my love of acupuncture. So that's really gone well hand in hand. And I get to do fun stuff like this and share my love. So thank you for having this today. So what is acupuncture? Contrary to this cute little cartoon where they're throwing their little spears and the mammoth says, that's odd, my neck feels better. It's actually stimulation of a specific point on the body with a specific method, resulting in a therapeutic homeostatic effect. So homeostasis is obviously rebalancing. So you want your body to be balanced. You want your good and your bad to be balanced. If you're out of balance, you're generally not healthy. So that's what acupuncture does, is it wants to restore balance in your body. So you're using your body to restore balance in your body. So I'm going to go over history, how it works, how we use it in diagnosis, how we use it for treatments, complications of using it. Everything has side effects, I will say. And then what to expect when you call me out and I come and see your horse. I have a little video clip, basically kind of talking about acupuncture and a veterinarian side of it.
People may not immediately put acupuncture to veterinary medicine. However, acupuncture from a veterinary standpoint has probably been almost practiced as long as veterinary medicine. Sometimes addition to acupuncture helps you do a better job, but sometimes it's the only thing that gets us over the hump. As far as things that we treat most often are the things that respond to musculoskeletal problems and other things. And that's because that's a lot of the things that acupuncture is good for. Everything better. Acupuncture stimulates the body to heal itself. Those veterinarians that are skeptical, they're doing it in a sincere way. They want to do what's best for their patients, and they don't want to recommend anything willy-nilly. As far as a placebo effect on animals, that's not possible. What is possible is a placebo effect on the owners, because the owners feel that just because they're paying for it and having something done, it must surely be having a positive effect. So one of the responsibilities as veterinary acupuncturists is to filter that part out and actually look at our patients, see what's better, and then ask good questions. You know that when needles are placed, those needles are stimulating a neurovascular bundle. You're getting the release of endorphins, epinephrine, histamine release, and all things that we know from a physiologic standpoint are involved with decreasing pain, decreasing inflammation. At the end of the day, whether you can explain it from a Western medicine standpoint or Eastern medicine standpoint, if you're getting results, then that tells you the evidence that you need to know.
All right. So it's a little bit hard to hear there, but
And I was like, well, what do we
basically, they're talking about use in it, and basically what I wanted to show was, why not, was a lot of people come to me and say, like I've literally had someone say, oh my gosh, don't come out here and throw needles at my horse. And you're like, whoa, I was not going to do that. Like, I am not the caveman in that cartoon. So acupuncture is a very calm thing. It's horses sometimes will even look sedate. It's not very painful to them. It depends on what point you're using. Some of them are very stimulatory, and some horses have a lot of pain or muscle spasm in that area. And so when we're choosing points, we want to choose points that we think are going to be effective, but not painful. And sometimes we have to work our way through that. And then you have to think about your constitution of your horse. And we'll talk about that later on. But I just wanted to show that these animals are not anxious. They are not excited. They're not worried. We're not sedating. Okay, except for the bear. But the bear was sedated because it's a bear. But we're not generally sedating these horses. We're not generally sedating dogs. We are needling them, and they are standing there, and generally they just feel relaxation. And I'll tell you why later, because people go, I think you sedated that horse. Yeah, because the acupuncture is working. But the history of acupuncture is that it was actually started 2,200 years ago in obviously China. The first veterinary texts are seen around 450 BC. So people actually writing down what they're doing and what works. And that was specifically acupuncture in horses. So what the Chinese did is they actually mapped out meridians or channels on the body based on their observations about how it was working and what it was affecting. And they also mapped out or thought about these constitutions and how certain people with certain personalities have certain issues in a common way. So for instance, I'm fire. I will generally have heart issues, blood pressure issues, those kinds of things. And if you are earth, you will generally get GI issues. So it's like it pieces together with kind of the personality you are. And that really works kind of cool. That's where it kind of starts to get a little bit almost voodoo, because sometimes I can tell what horse personality you are. And then I can be like, oh, have you had tendon and ligament issues along with your eyes? And people will be like, yeah, how did you know? And that is from their observations. So they observed it and they've recorded it, and we've gotten to learn from this extensive experience. Obviously, when they started this, they were using all sorts of things that we don't use now, but they use stones and twigs and bones. And then finally we came to needles and sterilized needles now. And so we've kind of come a long way, but we've used the same thought process throughout it. So in humans, we have over 361 points. And in horses, they've transposed about 173 points over the thousands of years that they've done this. So the reason that we can do acupuncture and transpose it from one animal to another, the reason we can do it on a Chihuahua and a Shire horse, is because all of it is based on an anatomic measurement from the actual animal. So it's a Schwinn, which is the width of a rib. So everybody has a different Schwinn measurement. And so you use that. I always measure the Schwinn when I go to a horse, and then we go from there. So that's how we can transpose them and move it through. I think that the popularity of acupuncture has happened more recently because, you know, we're trying to do more homeopathic things, less medicines, right? So if we can decrease the use of like chronic use of bute, then people are interested in it. If we can decrease medication use around our FEI events, people are interested in it. So, you know, we've kind of caught this more natural way of hoping to treat things. And I think that that's wonderful. You know, they're drug testing at events, so people are wary of that. And then just people kind of, they don't have anywhere else to go. And so they'll call an acupuncturist, because we frequently get called when everyone else has done their stuff and there's nothing left. They don't know what else to do. And so maybe acupuncture will work. And it actually became popular in the United States. Well, it didn't become popular. It was introduced to the United States in the 1970s with President Nixon's visit to China. And one of the reporters that was traveling with him, he actually experienced a medical event and ended up having surgery there. And in China, when you go to surgery, you actually get acupuncture done to decrease your surgery. Like the inhalant anesthesia is decreased if you use acupuncture along with it. And also if you use acupuncture for pain relief, you don't need as many pain medicines. And he was just floored. Like he was like, whoa, what? And so he wrote a piece about it. And I have not found that piece of, I have not found that article yet. But he was so excited, and he ended up writing in the newspaper about it. And then when Nixon visited China again, he ended up bringing his own physician to learn it. So it's kind of interesting that that's kind of how it's come in. And I believe that's also kind of when the teacher that I had in Florida, the school that I had in Florida, they kind of started immigrating here to teach that, basically, acupuncture. So how does it work? So we know that there are meridians. And so the meridians are, maybe this is where I should have had a picture of it. Basically, if you look at this book over here, you'll see this black line with these points on it. And so that is a meridian. It's a channel that goes through the body. A lot of them start at the eye and end in a foot. They'll go over your back and that kind of thing. And it might seem random to certain people, but it's not. And they're actually found in very specific areas if you study it. So they're actually found at high densities of free nerve endings, an artery, a vein, and lymph vessels. And there's always like this pocket of mast cells around it. And that's not the case if you do other points on the body. This is exactly where those points are. And those are the points that they've mapped out. So it's not everywhere on the body that this happens. And also the points are always located when this happens. So that seems very interesting and also kind of odd, but also this was what they have observed and treated over these thousands of years. We also know through scientific studies that there's decreased electrical resistance and increased conductivity in those areas. And so basically, when we think about how muscle spasms or muscles work, how your heart works, that kind of thing, we're using electrical conductivity, right? So we know that these are very important uh, spots on the body, basically, and these are associated with these points. There's 4 different types of points, and so I'm just giving you those. Basically, this is where they're found, and they're found all over the body, on the legs, on the arms, if your pet has arms, on the head, you know. Perfect.
Which ones are it on yet?
Too long-winded.
No. Lack of, we didn't charge the battery, probably.
There you go.
Probably on me.
All right.
But yeah,
Good.
Hi.
Hi, come on in. And
Well, I didn't know you were here. It sounds
Yeah.
very interesting, and I only have a few minutes if it doesn't okay to
perfect.
jump in.
Do you want me to answer a question or you want me to keep going?
Keep going, and I can
Okay. All right.
I'll announce later. That's okay. Okay. And the door is unlocked, so if you need to sneak in, just
Yeah.
sneak on in. We did unlock the back door. Thank you.
So we also know that when you have pain, your muscle body actually gets shorter. And so you actually have tension over joints. And so this, when we get acupuncture, it actually causes depolarization of the muscle. So the muscle actually relaxes. So instead of having all this joint pain from all this muscle pressure going over it, this actually helps to relax that muscle, depolarize it. So it's not tense, it's not contracted, it's not shortened. Also, there's increased microcirculation. So there's increased blood flow to the area. We know that in lots of our different complementary therapies, we're just trying to get more blood flow to it because we know that the body with increased blood flow will kind of get more blood there, get more oxygen there, get more of those cleanup cells there. So again, we are providing the micro injury, and that gives ongoing stimulus. So me putting a needle in your horse, I always say that the peak is about 1 week later. I've caused the micro injury, and that's what I think is a little bit tricky to see about acupuncture, is that very few times am I putting one needle in, okay, basically never, am I putting one needle in and the horse is like sound and perfect. Okay, that's not how acupuncture works, even though I wish it did. You basically put in a system of needles over time. You're trying to recall the body, recall the body, recall the body, and over time the body's working, the body's working, the body's working, and over time it will heal itself. So that's what we're doing. And again, I usually tell people, if you see something, you'll generally see it in about a week, and hopefully you'll see like improvement, 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 improvement. Oh, we're doing great now. Like that's what I usually tell people. So when you are going to do acupuncture, you're going to have to commit to more than one treatment because we didn't really do anything. We need to do.
The best case scenario treatment if it was your own personal horse.
Yeah. So that's a totally loaded question. So I actually had an amazing, I had a facial paralysis. I did one treatment. I think it was the same day or the day after. Next day, face was back to normal. Woo! I look like a hero. But then I've had, a 27-year-old mare who has an awful end-stage stifle. Well, we're never going to fix that horse. I'm doing ongoing treatment. Sometimes you have back pain horses. Well, what is the root of the back pain? Are we fixing the problem? Am I getting it better? And then we're kind of tweaking it over time. So it totally depends on what we're doing, what we're treating, and that kind of thing. That's why I love call me, email me, Facebook message me, and I usually say like, this is what we see, blah, 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 blah. Like I have a paper over there about head shaking. And so they saw a 64% of the horses that they treated improved with acupuncture, but it took 6 to 10 sessions. So, it's just hard to tell people, like this isn't a one and done. You kind of have to do it because it's a very gentle process in a way. You're just calling the body back to repair itself. So a real easy way to kind of think about acupuncture too is if you've ever used a twitch. A twitch is an acupuncture point. And there's actually 2 ways in which it works. So if you twist at the acupuncture point, it releases endorphins and they kind of get a runner's high. They kind of get like glazed over when you use one. So that is you using that point in a good way, and it releases it in a nice, like they're just kind of happy in their little endorphin high. But when you poke that spot with a needle, it's called the resuscitation point. So basically you can bring people out of like a coma in a way. I wouldn't say a coma, but like if they're unconscious and you stick a needle at the base of their nostrils, it is so stimulating. It releases so much chi and energy that's why they call it a resuscitation point. So how it might be used is a dog that is basically going to a coma. You can stimulate that point to give yourself time to kind of treat that dog so that it won't be in a coma. So that would be one way in which you would use that. Have I ever used this point other than in this fashion? No. I use it to give them the runner's high so I can do what I need to do so that we're both comfortable. So there are different methods of using acupuncture, and it's not always just needles. So this is generally what it looks like. I have some needles out on the table. So they're 3-inch, 4-inch, 2-inch, 1-inch, half-inch needles. They're 32 gauge. So when we vaccinate, we're using 22 gauge, 20 gauge. These ones are very, very, very thin. But that is, again, why it's a very specific point. There is kind of a field in which you can go, but you're trying to get to the nerve. You're trying to get to that artery, vein, nerve area. So you're not stimulating the skin. This isn't about the skin. This is about getting down to where that nerve is, to where the artery, vein, nerve bundle is. Another one that I really think has a really great place in acupuncture is electroacupuncture. I have my little unit here. I use this for facial paralysis. I use this for injuries to nerves, radial nerve paralysis, those kinds of things. They love it in back dogs, for instance. This helps in weakness. So when your nerves don't seem to be firing correctly, or you've had a nerve injury and you need to get the nerve to heal to itself, you use this to kind of recall the nerves back to the area. You say, like, hey, remember, we need to connect back. And so that is why we use electroacupuncture. There's also been studies done like doing sham acupuncture, which is basically putting needles in non-acupuncture points, acupuncture, and then electroacupuncture. And in horses with things like back pain and severe pain, electroacupuncture is the best. Acupuncture is good, and then sham acupuncture does nothing. So there has been actual studies about kind of where you will use different modalities, and electroacupuncture has its uses in both kind of nerve issues as well as pain management. Another one, that one's later, but hemoacupuncture, which is when you release blood, it's bloodletting. You don't do it like in the 1800s where you just like do a bunch of it into a plate. You're just like, it's just a few drops. So basically in laminitis horses, I always try to kind of tell people when your horse has laminitis, they kind of feel like they're having a pounding headache. Like, you know, that artery at the back and the artery in the vein, they're just pulsing blood. Like, you can feel those digital pulses. They are bounding. And so we know that there's a lot of blood there. So the Chinese would release that blood because it's not helping at this point. It's too much. It's an excess. So what you do is you actually just tick those nail bed points, which are basically at the coffin joint, I understand, but it's not deep enough to go in the coffin joint. You basically just ting those and they will have little blood dots, and it will improve their pain for a short time. But there is a space for that, for fevers, that kind of thing. You release the heat. Anhidrosis kind of has the same thing, the non-sweaters. You kind of want some blood to come out. I also think of this as in when you have an injury, sometimes you can think of it like a bruise. What is a bruise? It's a little blood clot. So if I'm releasing some of the blood, it's a good thing, right? Like, we don't need it there. It's not doing anything helpful. So sometimes when I take a needle out, we do some hemoacupuncture. Some of the blood is let out. And I think of that as kind of helping out that area of bruising. And I also think of it like letting go of the excess. Basically, it's too much. Also, if I'm a veterinarian, I'm thinking, I got really close to that point because it's an artery and vein and nerve, and I almost hit it because I was in either a vein or an artery, and that's great. So kind of give myself a little pat on the back. Other thing that we can use, this is not laser, but is laser. So if I have a needle-shy horse or a back sore horse, and that horse is not letting me near them with needles, which happens very infrequently, or if you have a fire, you can use a different modality. And so laser, actually, they have lasers that will do acupuncture points because it's a very specific type of laser that does a deep sensation. It's like a very sorry, I'm losing my words, concentrated deep penetration. And so you can actually hit the the acupuncture point with the laser. And I've done that a few times on some horses that just were so needle phobic. It was dangerous. And I don't like to sedate horses for acupuncture because I like them to have a full effect. And so this was actually a great way to do it, was with laser. The burning of marshmallows is what it looks like, but it's actually not. This is called moxibustion. And so that is actually, it almost looks like a little cigar of herbs. And so this horse specifically had what we call in Chinese medicine is like a coldness. So if we think about how we move through life, we kind of think about our elderly. They're usually cold. They need a blanket. This horse was an older horse. She had arthritis. A cold in their bones is kind of what they liken it to. And so what you do is you warm up their body through warming up their points. And that should help them with their inflammation. And so she was actually so painful that she had tendon contracture. So she actually wouldn't stand on her heels. She'd always stood on her toes. And when we did this and I burned these, and she was fully awake, like I'm standing there lighting these up and she's fully awake. She's fine. And you let these kind of burn, and you can actually feel the needle warm with your fingers, and they tolerate it. And it seems odd, but they actually really enjoy it. And she was actually able to put her heels down. And the heels being up is, again, muscle contraction around joints, which causes some of our DJD problems that we're having. But also it's just chronic pain. You'll have that happen in foals too, where if they're a lot painful, like if they have a lot of pain, they will contract and they'll be up on their toes. And it's just literally just muscle contraction. So if you can get them to get out of their pain cycle and let those muscles depolarize, they can walk normally again. I'm not going to say normally because she was a severe arthritis horse, so there was already bone damage there. But the owner was happy with where we could get her to go out in a pasture. So acupuncture, I actually really don't like this slide because acupuncture seems like it can treat everything, and nothing does that. So I'll tell you what I really enjoy using acupuncture for, and then you guys can kind of also do your own research and think about how it might work. But basically, Dr. Castles and I at Homestead, we used to kind of do this fun game where I would scan the horse and tell him what I thought was wrong with the horse. Well, we'd tell Rachel because Rachel worked for it at that time, and then he would scan the horse, or he would do the horse's lameness exam, and then we would compare notes. Because you can actually take a scan of a horse and you can say, these points together usually mean that they have a hock issue. These points together usually mean they have a stifle issue. These points here usually are suggestive of gastric ulcers. So I can tell you a little bit about what I think is happening, but when I'm visiting you, I'm your acupuncturist. I'm not your veterinarian. So I can say, you may want to check in with your veterinarian about scoping for ulcers in this horse, or when was the last time you had hock injections done, or whatever. And so that's how we can kind of use it for diagnostics.
How do you check those points? Is it through pain tolerance or sensorod?
Yes, I know. I wish I had a horse here. So basically, you take a pen, a needle.
Okay, so it's pain.
Yeah, and you run it along those meridians. So I'm literally just doing this and then watching for a reaction. Okay. And some horses, find a lot of draft horses, they do nothing. They will be crippled painful and they will just stand there stoic as can be. And then some horses, they'll just fall to the ground with anything. And you're like, well, I don't know, everything's positive here. So it depends. A lot of times you're getting maybe between 3 and 10 points that are positive. And sometimes they go in a pattern and you can say, wow, these are all really strong for a right stifle, or this is all really strong for severe neck pain or ulcers or whatnot.
So as far as the allergies go, you can just tell if they have allergies, but you cannot tell what they're allergic to.
So these are issues that I treat with acupuncture. That's why I'm saying it sounds like a silver bullet. It has everything. But yes, I like to use it in allergies because what did we talk about before? How are we using acupuncture? So acupuncture goes back and tells the brain to stimulate the immune response and clean it up. So my son has food allergies. He also has everything else wrong with allergies. So I know that like if I can re-stimulate the allergies and get the body to say like, whoa, there's something wrong in this part, then that should help. And so with allergies, a lot of what we see in horses is heaves, right? So when we're seeing allergies in horses, we're generally seeing them huffing and puffing and everything. And so if I can help with heaves has been shown to be helpful. Now, I usually get called when the horse is nostril flaring every single day, and that's too late. I can't help with lung pathology at that point. I can help you in the beginning when you're starting to use your Zyrtec, or your hydroxyzine and your inhalers, and you've called because your horse is struggling to breathe and this, that. That's when I'm going to be helpful because your immune system is high and it needs a cleanup help. That's when I'm helpful in heaves and allergies. I can do skin. Obviously, it's more difficult because I can't use all the points.
Well, I told my daughter, she's pro rodeos, and
yes.
She has a nebulizer she uses on him, and she runs him on laces because he has a bleeder.
Yes.
And then the last few weeks, she started giving him a couple of cc's of Dex to run him on. Well, she noticed that once she started using the Dex, she stops along the road and gives it to him in the right amount of time.
That's right, because
she loads him a lot of times. He's putting his head down and blowing a bunch of crap out of him.
Yeah, so acupuncture would be helpful as an adjunctive. And again, I say it's a complementary therapy. I'm a veterinarian. I will never reach for acupuncture in a colic. Like, please use some Banamine. I don't know, tube it, do something. Please don't call me. I want, generally when people call, I say, have you been worked up by a veterinarian? Like, what is their diagnosis? Because here's the thing, I cannot treat things like we're going to go over contraindications. If I don't know what it is, it's possible I can make it worse. It's possible I can mask things like a pelvic fracture. I can make them better. And then what? So we have to know things first. So generally what I'm saying is, what are you using already? So if your horse has been diagnosed with anhidrosis, I want you to use the Guinness and all the extra other things that they're telling you to use. Everybody's got their regimen, but then I'm going to help you try to get that horse sweating alongside it. I'm never going to tell you to stop using everything. Hopefully we can decrease. So when we're talking about this, I would say don't stop any of your allergy medicines until we've got a handle on it. So again, I told you 3 to 10 treatments. So I will come out. How are we doing? Are we doing better? Maybe then we can inch off some of the allergy meds and see where we're at. And then we'll keep going. And then sometimes it's going to be, I'm going to need to see you seasonally for that. And we're going to want to start before it gets bad. Yes. So yeah, it can help with inflammation. So it won't unclog the ducts. Exactly. Yeah, when you have it at the point where it is clogged, you need medical intervention for that. If you have a horse that clogs every spring, it's most likely due to some underlying allergies, then we can treat that before we get to the clog stage or after to try to keep them from redoing. No, that's what I mean. A lot of times when I've gotten calls, it's end stage, and that's hard. Yeah, hospice is great for this. I can keep a horse comfortable in terms of lameness or body pain for a while. I've done that. Stall, like basically pasture accessible. EPM is a great one. So that would go into your neurologic issues here. So EPM is a good one because first off, EPM horses have an infection, right? And so you should be treating that infection with medications. But what has that caused? It's caused an injury in the nerves and in the spinal cord. So what will acupuncture help with? It will help with the inflammation of that. So sometimes when I was treating EPM horses, we'd also put them on Dex because of the inflammation. So I want to knock down the inflammation. But maybe I will do some Banamine and some acupuncture and your marquee or whatever you're using.
Are there specific acupuncture points for EPM, or is it based on what the horse is?
So it's both. So if I know I'm treating EPM, I will still scan, but I'm already going to have kind of a recipe for what we need to do with EPM, because we need to do things like, support blood, and we need to decrease inflammation, and there's points for that, especially inflammation in this certain area, and blah, 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 blah. So I'm going to have kind of a cookbook. But then looking at the horse, I might say, well, we also have this going on, so I'm going to add these 3 things. It's kind of like Cushing's. If I'm doing Cushing's, I've got my recipe, but also, is that horse not sweating? Well, then I'm going to add some of those, like.
So are the acupuncture points the same points as the diagnostic points?
No. There's things called trigger points, which are sometimes acupuncture points and sometimes just muscles that are really, really, really polarized. And sometimes I will treat those. Like if I'm scanning a back and it's just like super spasmed, I like to put needles around that area, or a needle I know will depolarize the whole area. And that's not necessarily part of a pattern. That's a geographic area. I'm treating a geographic area, not a whole syndrome, if that makes sense. Like, okay, well, this horse obviously has these points that are painful. They're not part of a, they're not part of a Cushing's pattern. They're part of this horse has neck pain. Like, this horse needs its neck treated,
But you have your Cushing's protocol, you have your EPM protocol that are kind of standard.
Yes, there's like a diarrhea. Yeah, I can show you in my book. There's no secret here. They published it. But yeah, if you look in the back, like 250s and on, I think, in the blue one, you take it off there. You can actually see cookbook recipes of like, if you find this pattern in the horse, which I'll show you how I find those. Actually, keep going more further back. Further back. There you go. Oh, maybe there.
Have people had you do this to like prevent injections? Like
so yes. So I can help keep horses comfortable. I think where people use it a lot is that they use it to prolong intra-articular, like the time. So you may not have to get hock injections every 6 months. Maybe now we're looking at every 12 months or even longer, because you got the inflammation down and we're helping the horse be more comfortable. We're decreasing the polarization of the muscles. We're helping the whole leg be better so it won't get that inflammation in the joint from all that. Yeah. Exactly. Yeah, so that's again from pain causing restriction over joints, causing then pathology, so causing arthritis, causing inflammation, sometimes even getting those, that helpful lining of the joint. It's just causing stress in it, and so now you don't have healthy joint fluid. So where acupuncture can help you get rid of all that stuff, all the surrounding stuff. So you treated the joint, but you didn't treat the leg, you see?
How long after they get injections would you do acupuncture? Does it need to be
same day? I mean, I'd probably wait like maybe a week, but I don't think there's any science to that. I think it's more that I think it's more just that there's medicines working. And so there's actually a list, and I've never memorized it. I usually just ask you what medications your horse is on, and then I go look. But basically, there's certain medications that will dull acupuncture or contraindicate and actually inhibit it. And so you can't use it at the same time that's active, that kind of stuff. So sometimes with that, you could probably have the needles in and have them injected at the same time. But are we working against each other? A little bit.
You don't actually do the injection.
I don't. I leave that to your trusted veterinarian.
Well, we have a real problem now because she lived in Nebraska and none up there used the Alpha 2.
Okay.
That's around home now. We use the Alpha 2.
I see. Okay. Well, we can talk a little bit after about different clinics maybe using different things in the joints. I know that lots of people have their recipes. And actually, maybe you as a horse owner are better equipped with that. But I know from my experience, certain veterinarians would do more different, IRAPs and PRPs and all those things. So she's just asking about, maybe afterwards we can talk about recommendations for lameness in the area. I don't know why it does this. Oh yeah. Okay. So we kind of have already talked about a lot of this stuff, but when I come out, I also, I usually kind of excuse myself because it's a little bit, when I went to the Chi Institute, I did still have this nagging feeling that this was kind of voodoo, because you're sticking a needle in a leg to treat like an eye problem. Like, it didn't quite make sense to me, and I kind of thought it was hooey. And this, I will say, the exam I do is probably where people go, what? Because it's a bit weird. Like, I look at your horse's tongue for color and like a film. But what do we know? Like, when you're anemic, you're pale, right? So also when you have inflammation in Chinese veterinary medicine, it's called stagnation. And if you have blood that's pooling, it might look kind of more purple. So they look for a purple tongue. Oh, okay, makes sense. And if you're kind of having a lot of inflammation and you're kind of feverish, you usually kind of have like red eyes. You kind of look a little red in your mouth. They're looking for that. So do you have an excess? Do you have a lot of heat in your body? So I guess when you think about the observation, you're like, well, I can explain those things, but it does kind of feel weird to like walk up to your horse and, you know, is your tongue swollen? What color is the tongue? Does it have a film on it? Those kinds of things. And then I'm touching your horse's ears. You know, are they hot? It's weird. Some horses will have a weird one hot ear. Okay. Is their back hot? Okay, well, that's inflammation, right? As a veterinarian, I know inflammation's hot. So if they have a hot back when they've just been around, because I don't want you riding the horse and then giving it to me, everything's hot in that time. Everything is reactive. Just don't do that. But if your horse has been hanging out and I come up and your horse's kidney area is hot, that clues me in as a Chinese veterinary acupuncturist, but also as a veterinarian, I know heat is inflammation. So I can explain things, but I can see how it looks. And so I know that this part is probably the oddest, but basically I'm looking at the body condition score. I'm looking at the constitution. I'm going to look at those in just a second. Back temperature, ear temperature, tongue moisture and coating, tongue color. I'm also going to take your horse's pulse, but I'm not counting it. Like, I'm not taking it for if it's 45 or 80. I'm actually taking it for how strong it is. If it's strong in all three areas, because that means different things to me. There's three separate areas that I'm taking the pulse at. And that's going to clue me into my diagnosis, which is this. And that diagnosis is not going to look like stifle osteoarthritis with DJD. It's going to look like kidney yin deficiency. And so that is different, because I'm not looking at it in a Western medicine sense. I'm doing Chinese medicine. And so I'm following, you know, you're seeing some stuff in there that you may not recognize from your own veterinarian. Yeah. And so, yeah, so, you know, so that's what I'm doing. And so other findings that I do, you know, that's where I'm saying, like, won't put heels on the ground, or lame left hind, or, you know, teeth need done, or, you know, something like that. I'm, of course, putting some of my actual real veterinary medicine on there, because I like to also remember that I'm not, I think the hardest part for me, just being your acupuncturist, is not being your veterinarian. And sometimes I think I step on toes, and I don't mean to, but it's like, I really want to make sure that your horse is doing well, because if your horse needs its teeth done, it might have some jaw pain. And if I'm treating the jaw pain, I'm going to be treating the jaw pain forever until you get the teeth done. So we're all interconnected, and we're all a team. So that's why sometimes I'll suggest things like, I'm seeing maybe some ulcer points. Maybe you should go talk to them. And maybe I'm wrong, but maybe I'm right. And so that's how we're going to work together. I'm also then scanning the body, and that's where I do my scans. And then I write my diagnosis. I try to diagnose everybody with a Chinese diagnosis. And then we're doing our treatment. So I'm writing down what needles I've used, if we've done electro, if we've done acupuncture or aqua and stuff like that. I try to do aqua on everybody. I use B12. It's our feel-good vitamin. I don't think anybody would not want to have B12. It makes you feel great. You do. It's very dilute. So yes, yeah. Actually, I think that might be the food animal version. Sterile.
I'm not going to do it myself.
So it depends. It depends. I obviously cannot inject in a foot. I can't inject it over, the points in the leg, but I can inject it into their bottom. I can inject it into the back. The back is tricky because your epaxial muscles, where they most frequently will break needles is actually in their back. So they'll actually like break the needle off if they have a lot of pain. So I don't like to use my 25 gauge needle to inject there, but sometimes I will. But I do a lot in the hindquarters because really what horse is not experiencing some discomfort there. And a lot of those you can get a point that's called a master point, and that will actually do a whole area. So I like to do those. So that's what I'm doing there. And then sometimes we're using herbs, and I think that's a whole other topic. Herbs are medicine. I mean, if we think about what medicines are, they are herbs. We've just decided to call them pharmaceuticals and put them in white pills. But really, they started out as herbs. And so Chinese medicine does have herbs, and I think that some of them are great. I think that if you have a marish mare, there's a really good one for that. I think if you have a horse that is sore all over the place, they actually have one called body sore. It's really great. Like I had a horse that would not let me inject any needles. They were so tense. Like everything was just and I put it on body sore, and then I was able to needle her, and she was a needle shy horse. And then I was able to be her, like I was able to vaccinate her afterwards because she was like, oh, they don't really hurt that bad now. It was before. Because again, she was triggered. She was so triggered that her threshold was so low that even my 32 gauge was too much for her. And so when I got her to understand and have that body sore and she just relaxed, then she could get treatment done. And then we could do acupuncture treatment. So that was like a failed acupuncture on my part. I went there and I was going to needle her, and then I just handed over the body sore and I said, see you in 4 weeks. But we were able to work on that. So these are the constitutions that Chinese medicine talks about. And I could spend a lot of time on this because I find this to be the really, really cool part about acupuncture and Chinese medicine. Because like I said, I'm a fire. So problems that I might come up with in my life are, in my heart. Pericardium is the sacral around your heart. Small intestine, maybe I'm really hot in certain circumstances. And then my small intestine, which is interesting, but I've always had trouble with my complexion. I've had trouble, I laugh a lot. I have a lot of joy. So those things all, talk about me. I talk a lot, obviously. I'm here. And so when you look at that, you kind of see your personality. Now, I don't think we're all 100% in one. And I think you change. Just like if you notice these, they kind of look like the seasons. So if you think about a child, a toddler, they're fire. Me, yeah. But if you think about a mother, she's earth. She's caring. She cares about food and digestion and transformation, and she's singing, and she has worry, but she's your home. She's the earth. And so probably all moms have some earth in us, right? And so then, you think about metal, and you think about grief and kind of quietness and dryness, and as you age, like your hair changes and stuff. I have that happening now, but like you're going through your seasons, but you've started out and you were fire and you were joy and you were laughter and you were loud and all this stuff. And so I think about, especially in, those horses where the yearlings will always have a little fire in them. So when I'm treating a yearling, I'm still talking about a little fire. When I'm treating a chestnut thoroughbred of any age, I still have a little fire in them, but I can see some sprinklings of the other things. If I have a bay warm blood mare or quarter horse, they're generally wood. They're boss mares. They're a little sour. They're a little angry. They're tough. But here's the ones where, oh, she has some trouble with her eyes. And then I ask, oh, has she have any trouble with her tendons? Oh, yeah, she did have a tendon injury. This is where I can get that information from, because they generally all have trouble with their personality. And so this is where I can look really cool and start asking history questions and kind of learn more. I always say that I think that my husband is water, and so he keeps my fire in check. And so that's also how I use it for acupuncture. So if I have a fire horse and it's too much and they have too much of it and it's being too much, then I need to go to the one across, and then I need to support that, because sometimes fire will consume earth or fire will consume this. And so that's, again, where you're going into a little bit too far out of our comfort zone as a Western society. But you got to think about how you're supporting the ones that might be harmed by too much of its opposite. So that's where you kind of go yin and yang and that kind of thing. Again, restoring balance. So if you have too much of one, you need to support the other one to calm that one down. So yeah, this, I'm thinking about making a questionnaire to send out to horse owners with questions that kind of establish where we're at in this, because this one's kind of hard on the fly to kind of go. And usually I can tell my wood and my fire, but these other three are kind of difficult. Usually your happy-go-lucky warm blood gelding is your earth. He's always going to take care of his rider. He's kind of silly, but he loves her so much. And then these guys, your quiet, conservative, steady, those guys, they kind of get a little trickier to weed out. So again, I've looked at them, I've looked at tongue color, I've smelled things, I've looked at them, I've listened. When your voice starts to crack, I was thinking about this morning. I did not get a good night of sleep, and I woke up and my voice was a little bit hoarse because I'm not doing well, right? Like I needed more sleep. I need more balance. So again, it warmed up a little bit with my coffee, but listening to your dog bark, and if your dog's bark goes bad, that's interesting. So abnormal voices or abnormal sounds are something that we think about as well. So again, I'm going to be asking you about all of these things, and they kind of seem odd sometimes, but I promise there's like a function in them. And then we talked about the pulse. And then, so this is when we're talking about the diagnostic points that you were asking about. So this is my little cheat sheet for it. But you can see that this myofascial syndrome is a little bit like fibromyalgia in people. Tendon ligament, I'm looking for these ones to be positive. Shoulder ones, so you can see the shoulder, it's red here, but I also need some from here. And then the hip ones, I need these. So you can see it's not just all about like this is your shoulder joint. It's not all about just having these positives. You need some of the distal ones, some of the ones from way far away too. So again, this is our stifle, but this one has to be positive for it, because that's the muscle belly that's going towards it, right? And then, we have some that we need over here, because again, this is the muscles that are probably trying to prevent too much strain on the stifle. So now they're working too hard, so now they're painful, right? So you can think about it in ways like this. And then we've got your lower back, because now that's all hurting. Because if we think about when we start to limp, now you're not only just hurting in your toe, but now your back hurts and your hip hurts and everything hurts. And now your right side's starting to hurt. And so you're compensating for your original problem. And so I think that's how we've gotten a lot of these points. And you can see the stomach pain here and then here. That's what we call a somatovisceral. So that is a point that's not close to where it's at, but it's associated with it. And so they actually did a study with scoping on these points, and they would have the scanner, and then they would have it graded, yes or no, and they would scope, and they found that it was really good. I don't remember the percentages off the top of my head, but it was very good. And I used to do the scoping at Homestead, and I used to play around with it. It was very good. If your horse is positive on those, I always say maybe you should go do that. So with lameness, these are some of the things that I've treated with acupuncture. So again, neurologic stuff, EPM, trauma, disuse. We know in EPM, usually it's one side of the hip versus the other. I can do some electro on those. But again, I'm going to be telling you that you need to follow the physical therapy from your veterinarian. You need to continue those medications. There's not a time when I'm going to have you discontinue your Protozil or your Marquis, because we need to do those. But this is helpful.
Like after they've been treated, there's no active diagnostic anymore, and they've completed their course, but yet they're still stumbling.
Yes.
Is that something that would help?
So it depends. Again, if that is a chronic scarring issue, then no. Like if we've treated them with acupuncture and we've seen like an improvement and now it's plateaued, like at some point the horse has damage in the body. Scar tissue, like if you have fibrotic myopathy, you'll never get 100% back, right? Because there's fibrosis there. And although we can try to break down some of it and try to prevent new, we can't fix the actual fibrosis of it. So sometimes we can never get them back to 100. But maybe now you're getting them back to 90 instead of the 70 that you would have with just treatment, with just Western treatment, for instance. And that's I have some studies over there as well that say that basically if you used no other treatment other than Western, you'll do a good job. If you use Western and acupuncture together, you're going to do a great job. And that is the case in most cases, is that when you add acupuncture to your toolbox, that's what I like to say, it's just another tool in my toolbox, and I love it for that. You are going to increase your chance of having a great outcome. Now, we can't promise anything, but if you're going to put it all out there, then this is another tool in your toolbox, and it's going to help. So tying up, so tendon or ligament issues. So this is one of those where like, oh, I had stem cells injected in this tear and my horse is now, on rehab. That's a great time to introduce also acupuncture, because the acupuncture is going to activate those stem cells and it's going to help the body use those stem cells. So I love it in terms of like your horse is in rehab. You're not able to do a whole lot other than kind of sit and wait and do your walking and your bandaging. Add acupuncture here, right, with those stem cells, because that will activate those stem cells. That will activate your joint treatments. That will help your body utilize those correctly. And
help when you break your leg and you don't use your leg for well, so you bring it.
Yes, it is. Yeah, it basically helps the body to utilize what they're supposed to be doing correctly. The fibers in the tendons and ligaments again, a study where they actually show that the fibers were more likely to be nice and linear instead of that noise that we don't like to see. So it will help. Again, back pain, a lot of times we've already done all the meso and everything, and then we add this along. Again, it might help to prolong the time in between your joint injections, that kind of thing. Navicular disease, another great one, can help with the inflammation of both the bone as well as the pain. And these are all just very like elbow pain, but it helps. It helps with the inflammation. It helps with all that. Laminitis, it's great in acute laminitis cases. Again, that's where we get like the excess blood letting out. I want you to use your farrier. I want you to use pain medication as well as this to modulate the pain. Maybe we can back off some of the pain medication. But you still have to treat the predisposing cause. But we can also actually focus some of our acupuncture. This is kind of one of those times where we're going to treat the laminitis, but I'm also going to throw some in there for the endocrine part, which is the cause of the laminitis, if that is the cause. And then we can help with the circulation of the hoof to make it better. Not necessarily more, but better for the horse. So again, we kind of talked about the suspensory injury. That's kind of where we're talking about those fibers healing correctly. Again, arthritis is a great one with this, DJD, OCDs, like those little bone chips that they get in there. Because again, we're decreasing the inflammatory response. You're still doing your treatment in the joint, but you're using this to help the body stop that so that it won't continue to need them over and over. Because really, once you start your joint injections, maybe you should close your ears. No, I'm joking. But then you're doing it. It's not a one and done. Like, what horse really has had one set of hock injections and never again? You're really starting it because there's pain, there's pathology, there's something there. And again, with acupuncture, it's generally that we're seeing those muscle bellies contract over the joint, causing pressure, causing the joint to be unhealthy. So we can help with the muscle polarization. We can help with the inflammation. So let me help, let's use this for what it's here for. I also get called for a lot of these. My horse isn't performing well. It's turned into a real pain. It's just not the same way it used to be. He's so, like, some horses are biting, some horses are kicking out, especially when they're getting groomed, when they're putting the saddle on. They've had their vet out. They've done radiographs. They've done bone scans, and sometimes they even get to hear, like, the MRI is normal. Like, what am I supposed to be doing here? They've blocked their horses. I mean, they have seen the gamut of it, and then I get called. And this is, again, where acupuncture can really shine. And this is this syndrome that they've found. And it's basically where they've been in pain and now they're in fight or flight. So it's kind of like we're talking about now with people, like cortisol and stress and being in a fight or flight, like constant stress mode. This can happen to horses who have been through pain. You fix the pain, but again, it's the mental pain pathway. So we're still going over that. Like, you fixed everything, but we still have this happening. And so now they're actually causing pain. Like, now they have kissing spine too. Like, now they have this, now they have that. And it's frustrating. But sometimes we can treat the trigger points and we can treat the pain and we can reset the pain pathway. And then that can be the last of the cleanup. And then we're good for now. But that's where acupuncture has done really well. And I always like to say that people usually call me after they've called everybody else. They've had all the chiropractors and all the Magna Wave and everything, and they've done it all. And then they call me, and then we're kind of working on something like this, I think. And so then we have to do some acupuncture. And these ones take a while because they've been going on so long, and it's a lot of it's up here. These are the contraindications and also precautions. So we talked about, getting a veterinarian's point of view. So I'm not going to needle a sarcoid. That'd be a bad idea because it will make it grow. It'll bring blood flow to it. Yay! Wait. So I don't want to treat tumors. Really, I don't want to do that. If you have a pregnant animal, I don't like doing them. Because you're moving energy basically, and there's points that will actually elicit the uterine contractions and that kind of thing. People use it to get themselves to go into labor earlier than they may have wanted to because they're impatient. I mean, so I don't do pregnant animals. Let's do something else for a while. I will probably tell you to not have your horse ridden that day, basically, because if you scan a horse after they get out from riding, everything is positive. It's very confusing, and I can't take the temperature on anything, and it's just not beneficial to either of us. When you're doing really old horses or foals, you don't use as many needles. So if I'm treating diarrhea in a foal, something that's, very, like they're dehydrated, they're not looking great, I'm using 3 needles, very few. I'm just really quietly telling the body to go and clean it up. If I'm doing a very old arthritic horse, I will stick to less than 10 needles. I'll try to use my best 10 points essentially, because again, on a healthy middle-aged horse, I might be using 15, 20, sometimes 30. It depends on how porcupine we want to go that day, but not on the weak or on the elderly or on the very young. I don't want to treat broken bones that I don't know are broken. And broken bones in horses, that's tricky, right? But we don't really treat a lot of those, right? So I accidentally, believe that I was part of maybe a pelvic fracture and I was treating the horse, and that was not beneficial to the horse. So I want to know that we've ruled out everything we can medically in a lot of these cases. And again, cancers, that kind of thing. Some of the points, when you look at them, like there's one that goes right into the stifle joint. Like it's, the one that you would inject a stifle in. And so you're thinking like, wow, you're going to stick a 2-inch needle in there. And yes, I am going to stick a 1-inch needle in there, and even that seems too big. But they've done studies. So at this gauge, if you have a clean horse, I'm not saying you brought it in from a muddy pasture and then you like knocked it off a little bit. If you have a clean horse, these needles with dry skin do not bring in bacteria in like 99% of the cases. So joint infection is like septic joints are very, very, very low as a complication from this. If you wet it down, like some people really want me to like scrub, like I'm going to do a joint injection, it's actually worse. So when you wetted it down with alcohol and then put the needle in, it actually did start to drag the bacteria in. So that's why when I come to see you, I'm going to say I want a really nicely groomed horse, generally, that hasn't been out rolling, but we're all realists here. So like do the best you can. And then we might have to look at the horse and say, that stifle's kind of dirty that day. I'm going to not do those points. Or, well, it's been muddy this fall. I'm not going to do the ting points, which are the lowest points. Like we're just going to focus on these ones up here. So sometimes we just have to change what we're doing. But joints, tendon sheaths, and tendons, those ones we do. And we do them knowing what we know. And we try to do everything safely. I don't scrub for any of mine. And if you're uncomfortable with it, we will just not do it. So I always try to talk about those things as we're doing them. So again, this horse is bleeding from its acupuncture points because we're again releasing some stagnation, I like to say. Releasing some of the blood that's just been sitting there. So you can see it's kind of dark. It looks like a bruised area. And so these are the things that can happen in rare cases when we're doing them. So I can get cellulitis because that needle may or may not drag in some bacteria. It doesn't in most cases, but anytime you're inserting something into something else. I can cause bruising because maybe I did hit the artery in the vein a little too hard with my needle. I caused too much trauma. I can cause bleeding from points, which some people are really scared about. Mostly it's just the flies because that's annoying in the summer, but I try to wipe it up and we'll put some fly spray on it. And then they can have some soreness. Like they can actually get worse before they get maybe better, or maybe they get worse until our third treatment and then we're getting better. And sometimes I treat the first thing that we think we're treating and then they get worse. And then I'm like, oh, but sometimes what you treated first was not the immediate problem. Like that wasn't actually the problem, that was the symptom. And then this was actually the problem. And so now I have to treat that. So sometimes we're just taking off the mask, so to say. And then the last thing, and I didn't even, well, there's kind of two things. Needles can break, and that's terrifying, and I lose sleep over that sometimes just thinking about it. That's not at all good. That would be the worst. Like, that's one of the worst things that can happen. Needles breaking off happens when you put them into a muscle, and that muscle spasms so hard that it literally breaks the needle. And in that case, you would need to go have them surgically removed. So we'd make an incision, remove it, suture it. That's obviously like, don't want that to happen, which is why I usually palpate. We kind of talk about like, this muscle's really tense. I try to do some other needles to relax the polarization, blah, 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 blah. And again, that is why acupuncture, I think, is kind of a walk. You do your first one, you do your second one. Sometimes after the first treatment, we can now do these needles. This is great. Look at this. We can do these needles now. And then on the third one, we can do all of the needles we wanted. So it's just reading the horse again. More in dogs, and sometimes I like to do horses when they're on a flat surface so I can see the needles when they drop out, because horses push their needles out. You've seen it. And so some people are like, it's fine, we'll do it in the stall. And I'm like, because the worst thing is the horse pushes out a needle and now we're literally needle in a haystack. And then is the horse going to eat the needle? I don't know. Probably not, because they're horses. They're not going to eat that. They don't eat some of what we want them to eat. So I don't know. We mostly talk about that in dogs. Dogs will literally be like, oh, look, a needle, and they'll eat it. And you're like, and you give them bread and everything else. So we can treat that by watching it, but obviously everyone has like a heart attack. And I usually like, okay, clear the stall, clear the hay nets, like, and that's not fun either. So I like to do it on a flat, non-bedded surface. I don't like them to eat during it because then I'm thinking, oh my gosh, what if it went in their hay and we have to throw away hay and blah, blah, blah. So I know a lot of people around here use chiropractic, and I love chiropractic. I think it's great and it has its place, but they're not the same. So it's not like, oh, I'm going to probably try acupuncture this time. We're not the same. So we can't be used that way. I did used to partner, or I mean, I still do. I love when people say, I'm having my chiropractor come out this day. When should you come? Because that's perfect. Because you know what they do? They manipulate the joints. But you know what happens when your muscles are still very polarized around that? It just goes right back. Like, so they've manipulated and they made your horse so comfortable, and then your horse just squeezes everything back. But if I can be there to depolarize and help the range of motion, then the range of motion that they gave you back will stay. And sometimes I help. Sometimes what I've done too is I meet with the chiropractor. The chiropractor does their exam. I do my treatment, and then they're able to just much more easily do their adjustment. And I love that too. So we work hand in hand on two different things that accomplish a much better overall picture. I can do it at the same day. I can do it the day after. You know, when we're pushing things to weeks apart, I don't really think it's that helpful, because if you depolarize it a week later, I don't know if that's still helping with the manipulation that they did. But this is what it looks like. It's not a very new picture of me, but I'm putting in needles on this horse. I put in some of the bladder. These are the bladder rich ones that are coming out from the spinal cord. I love doing my back ones. I think most horses need their backs done. I say somewhere between 3 and 10. There's one story of like the first time I ever saw acupuncture done. It was my teacher down at the Chi Institute. Like when I'd seen it done in person, I was actually like paying attention, because otherwise it's like somebody on the other end of the barn. This horse would come in because, you know, they'd had everything done, blah, 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 and they're still on the left hind lameness, blah, blah, blah. And this guy goes, before we start talking about like everything on this horse, I'm just going to try one needle just to see if it'll help, just for fun. Like, just bear with me. And I'm like, oh my gosh. He literally put in stomach 45, left it in while we were talking, and then he had her trot him off and he was sound. And we didn't have a horse to work on for the time being, but that's okay. Like, that was the only time I've ever seen that happen, but that's amazing. And that was one of those, like, we have done everything. And he was like, well, let me try this. And it worked. And acupuncture sometimes is magic like that. Most of the time it's not. It's, again, recalling the body. So again, we're doing sometimes weekly, sometimes monthly, sometimes every other week. And again, sometimes treating the initial problem, it brings out a secondary issue. And I'm sorry about that. Sometimes I don't have a magic ball. I just have my trusty pen or needle cap that I'm scanning with. I loved all the questions. If you have more questions, I'm happy to answer them. I'm on Facebook. That's basically where I'm at. I have an email. I have a cell phone, but I have kids, so I don't always answer that. But I will text, and I will message, and I will email as much as I can, and I will find a time to call you back. I also do give seminars, and so I'm happy to come and talk at your barn or give a demonstration or that kind of thing. I think acupuncture can help. I just don't think people know enough about it to try it. And it's hard. It's hard to put your money out there and hope, especially when I'm asking you to do several sessions. And I get that. So, anything else?
What's the normal cost?
Yes. So I charge, for me, I can't speak for the other ones. There's a couple.